The most important problem that is chasing the youngsters nowadays is unwanted chest growth, called as gynecomastia. Nothing but unwanted growth of a fat tissue. We can see patients coming from 16 years of age, 25, 30, 35, whatever. But gynecomastia, they think there are certain centers which are unethical, they say with some massages, some injections, it may go. No. For the gynecomastia, there is one single treatment that's called as liposculpture or liposuction. But in Sriroop Cosmetic Surgery, what we do is the Brazilian technique. Whatever we do, any surgery, any treatment is all Brazilian techniques. It's nothing called an Indian technique. It's a clubbing of Indian, Brazilian and Thai techniques and Filipino techniques. In gynecomastia, there are two types of tissue present beneath the skin, around the nipple and the fat plane, the fatty tissue and the glandular tissue. Many people have a doubt that it should be cut, it should be removed, with forming a scar, to suck out the fat and to cut the gland. No. There are certain specialized cannulas with a river-edge knife-like small hole for the cannula in the Brazilian technique, through which when we are extracting the fat, we can extract the gland also. It's a specialized technique, most advanced technique, unlike the regular technique. So no need to worry about the gland, the fat, the gland, everything will be handled in the same procedure. So, for the gynecomastia, in the Indian technique, there may be a small port put here, there may be a cut around the nipple. But in the Brazilian technique, we use some specialized cannula where we enter from the axillary fold or a crease, we call it as axillary crease, a line, which is already there. So through the axillary crease incision, we enter beneath the skin and between the fat plane, and we suck out the fat, making a shape which is fantastically seen within just one day. But the loose skin takes time to tighten up. It may take around 1.5 to 2 months. They'll be using some garment called a compression garment inside the shirt. They can go out to regular activities after the first day, from the second day onwards. Small discomfort or pain may be there for about a week or so, but we don't need to call it as a pain. Gynecomastia surgery is not a big surgery. We don't need to call it as a surgery. It's a small procedure. Hardly a daycare procedure, 1 day stay in the hospital. Sometimes patients leave by evening itself. Don't need to have a night stay at all. You can just come with one of your attendant and just drive back home. It's a daycare procedure. People may think they have some side effects, complications, seeing the TVs or listening about liposuction. No. In Sriroop Cosmetic Surgery, be it a gynecomastia, be it a liposuction of the whole body, whatever, we have done hundreds of cases, and touch wood, we have never seen anything untoward happening. Because it's an organized center with the doctor, the team, everyone is just organized. And patients' feedback, you can see in the reviews given to us valuably with very happy reviews.